How's it going? It's a little gloomy out here, but that's okay. Let's talk about vitamin D deficiency, a common problem in Michigan. So we don't get enough sunlight, and a lot of people have low vitamin D. You do have to be careful. Sunlight does have its risks, and we'll talk about that, like cancer prevention and sunscreen, in another video coming up. So what is vitamin D? Vitamin D is a fat-soluble vitamin. Your body can make it, so that makes some experts say that it's actually a hormone. You do have to be careful since it is fat-soluble, because it can cause toxic levels if you take too much of it. It's not like the B vitamins and C, which are water-soluble, and your body can get rid of extra amounts. So vitamin D, there's many forms of it, and a lot of people ask, which one do I take? Vitamin D3 is usually the one to take in most cases. There are some exceptions. In a good amount, they recommend usually 600 to 800 units per day in people that don't get good sunlight. The elderly usually are recommended to take about 1,000. There's a lot of different debate on this. I even find that 2,000 seems to be the right amount to get people's levels in the normal range and keep them there. Sometimes if people are very low, there is a prescription form. It's 50,000 units of vitamin D3. It's called Drisdol, and you take it once weekly. It's kind of like a booster racket, and it kind of shoots you up to the normal range, and then you take a maintenance dose. Some people just even need Drisdol twice a week, and it's crazy, but I've seen it many times where that's what's required to get their levels in the normal range and keep them there. So vitamin D signals the intestines to absorb calcium, and that is important for many things. Most importantly, we usually associate it with bone density. You need strong, dense bones. This helps prevent fractures. On top of that, it's used in muscle contraction, so your strength is dependent on it, general energy, and we believe the mood as well. A lot of people in the winter, they crash. They call it a seasonal affective disorder or disease. Basically, some people, and I think there is some truth to it, they believe that it has something to do with less sunlight exposure and lower vitamin D levels. On top of that, it does have an immune function. People with MS tend to have quite a bit more flares and relapses with low vitamin D levels, so we usually try to keep that in the normal range. That extrapolates to the rest of the population, and you see that it probably has a big immune function. There's all kinds of different things. Some of it has some proof to it, and some of it's just subjective, but overall it is important to keep those levels good. I've seen only a couple of cases where people went to toxic levels. They usually were taking the Drisdol once daily, which is that 50,000 unit dose. What does it do? Probably a bunch of bad things. I think one of them got kidney stones. It wasn't under our care, but I have seen that before. Let's see here. That should summarize it. Like, comment, subscribe, and let me know if there's other topics you'd like to talk about. Thank you.